from how we do things in the West, and understanding that better in a way that we can bring that into our own lives.
Okay. That's good. And Dr. Basu, would you like to give a talk first on the way that you practice psychiatry, and then there'll be time for questions and responses after that. So that will be good.
Thank you. But first of all, today is a very, this is a very auspicious time and a very auspicious day, because at 4 p.m. on the 4th of April, Sri Aurobindo had gone to Pondicherry for good in 1910. And that's how he settled and the ashram grew. So this is just the time when he had landed there. And so it's a very auspicious. Anyway, that I work with consciousness. So apart.
Your microphone has stopped. Will you put your microphone back on, the little red icon in the corner?
It's okay now?
Yeah, that's okay.
It's okay now.
Mm-hmm.
Oh. So my main work is with consciousness, and consciousness from a spiritual perspective. So with whatever work that I do officially, I also judge patients from the consciousness background. So that is also something that I see. And we use the model of consciousness related health and psychology. We use a structure for that. And that integral health, for which I had been working, also integral yoga psychology, and mainly in integral health, and which Joe is very interested in, where we see a person from different levels of consciousness. So there are different levels of consciousness, and there are disharmonies between the different levels, which are evident in different kind of illnesses. But the main problem is this, that in our yoga psychology, what we call personality is known as the outer being. That is the surface being. So there are other levels of being also. The surface being is not the only being. So we have an inner being which is behind the surface being, and we have the soul element behind the inmost being. So it's a very complex structure. Now, why is this is important? You see, at the outer level, there are disharmonies between different planes of consciousness, and we just, if we restore the harmony, and we think that illness will be cured, but restoring the harmony there is very difficult, because all the planes at the outer personality are mixed with each other. They're very much what you call interspersed with each other. And then at the outer being, everything revolves around the ego. Now, ego is, Sri Aurobindo doesn't see the ego from a moralistic viewpoint. It is just an entity which has been made from all the elements in our personality, from our mind, from our vital, from our physical. So the ego is biased. It cannot do the work of harmonizing properly. So then what happens, all the adjustments and compromises we do at the outer being are temporary, short-lived. So to have a cure or to have a therapy which is more durable, you have to shift from the outer being to the inner being. Otherwise, it is very difficult. This is this is also a very new contribution of Sri Aurobindo to the world of psychology, that there is an inner being behind the outer being, and this inner being is connected with the cosmic consciousness, from where all the things enter inside us. And through the inner being, it enters into the outer being. Now, the channels of communication between the inner being and the outer being, there are channels of communication which are usually closed. Now, these are the channels which are called the chakras, which are known as the chakras in the Indian tradition. They are the channels of actually their communications between the inner being and the outer being. And what happens is that you have to know the technique of going inwards. So you can start from any point, you can start from any therapy, you can start from any plane of consciousness, and you have to travel inwards. And then the inner being is also a very risky area, because it is open to the cosmic consciousness, and the cosmic consciousness has positive vibrations, it has also huge negative vibrations. So that technique, you have to go inwards, and behind the inner being is the soul element. which is projected by the what we call the jivatma, or the self, which projects. It has a projection inside the being in the manifestation, which Sri Aurobindo called the psychic being or the soul element. So you see, you have a journey that you have to go inwards, and there is a journey that you have to go upwards also. So there are two kinds of journeys that you have to do if you have to have a perfect health. One, you have to go inwards, so you can harmonize all the different parts of your personality more and more better, in a better way, as you move inwards. And also, if you want to develop your own what you call your personality, your consciousness, then you also have to learn how to grow upwards. Through the inner being, you can go to the inner mind, and from the inner of consciousness. So there's a higher mind where there are all kinds of thoughts, and from the higher mind you can shift to the intuitive mind, the intuitive plane. So that's a different thing. So I'm just coming back to the illness model. You see, in this whole model, if you see that illness can occur due to something. Illness is always corresponding to some movement which is happening in the inside, in our consciousness. Outwardly we see its manifestation, and at the outer level, which we call our personality, whatever adjustments and compromises we do, it is not durable unless we move inner. We move to the inner being, we move to the inner being which is connected with the cosmic consciousness, and we move behind. Now naturally we'll ask that whether a person who is practicing spirituality, will it be easier for him to have a good health? Is it easier for him than the ordinary person? Here also there is a great risk. Actually, there are other risks involved. For example, for the person who is practicing spirituality, there are other dangers also which he has to very remember. For example, when he goes to the inner being, from the outer being to the inner being, there is an intermediate zone which one has to cross. And the intermediate zone, if one gets lost there, then one can have all sorts of illnesses, hallucinations, all sorts of discrepancies, deviations, all these things can happen. And then what happens with people who are very developed inside, the inner being is very developed in people who are highly spiritual, but the inner being can grow very fast and the outer being cannot keep pace. Sometimes this happens, that the inner being grows very fast and the outer being cannot keep pace. So there is a discordance between the inner being and the outer being. And because of this discordance, what happens that great people, great yogis, they also have great illnesses. We have heard that big yogis like Raman Maharshi and all, they had cancer. So you see, the reason is different. The ordinary person, one will be suffering for one reason. For them, the reason is different because the inner being grows faster than the outer being. And then there is another risk. In the cosmic consciousness, there are great negative waves, there are great positive waves. There are negative waves also which can enter. Once you are open, once you have opened yourself to the cosmic consciousness, which is a great art, you have done that. But that does.
We can't hear you.
In the cosmic consciousness, they can enter into your inner being and they can shut up the soul from the rest of the being. That is called possession in spirituality. Possession in spirituality doesn't mean that a ghost has come. It is not like that. That's the ghost has come like that and has possessed you. It is that the negative forces from the cosmic consciousness, they have entered into a being and they have put a shield, they have put a curtain so that your soul element cannot work on the rest of the being. Or the negative forces can go forward and catch hold of the ego, and that person can become a diabolical person. We see frequently in India, we have these cases where people start to be a very good yogi, very good sadhu, and after some years he becomes a very diabolical person. So what happens that in the beginning he was sincere, but he didn't know the technique of perfecting his personality. So the negative forces came and went forward and caught hold of the ego. So that means you have to work on the ego also. You have to replace the ego by the soul element. So that's a different thing. I'm expanding too much. It will become more complicated. But it is a very interesting thing, this consciousness structure. And in this consciousness structure, we can view illnesses at one point or the other. You can view, and we can use any technique at the outer plane. You see, I can use, people love variations. So people will love different kind of psychotherapy techniques. People will love different kind of therapies like allopathy, homeopathy, this therapy, that therapy. But main thing is that from the outside, you have to go to inside. You can start with any therapy. You can start from any plane of consciousness. Naturally, the psychotherapist will start from the cognitive plane. The homeopath will start from the vital plane. And other people will start from other planes of consciousness. But one has to go inside. One has to go inside. Then only a harmonization can occur and the disharmony is in the outer side, you can work on that more profitably. I think I'm making myself very complicated.
Surely not.
So what Joe writes is good, which is right, that the inner work is very important. The inner work is very important here. That outer work is always there, that we have all to do, but our main thing is there to surpass the outer work. For example, I will tell you a very simple thing. Suppose we are in a stress management, I am teaching relaxation to a client. It actually happened to me that I was teaching a client to relax. Now, because he was stressed. Why? Because he was doing some odd job in the stock market. In the stock market, the job was how to cheat people. So I made him relaxed. So he became a better cheat because he's relaxed. So you see, relaxation. So what happens? I made him a better cheat at the stock market. So together with relaxation, that is only 50% of the work. Then I have to teach the client how to expand in consciousness, how to go inside, how to develop oneself. Otherwise, there is no fun in this work. We are just what you call like a grocer giving what you call whatever the customer wants, we are giving that. So we want to do something different. And so we want to help the clients to grow, and in the process we want to grow ourselves. So this is a two-way process. The client grows and the therapist also grows, and for that something else has to be added. So whenever I teach relaxation for a space management, I also add also that all techniques, how to widen.
Gone again.
One becomes a what you call a better human being. So like that we can always transcend our immediate goals and go to some deeper goal inside, then which gives some value to our work. And this is a model which can be used by anyone in the world. It is something which is non-sectarian. It is not a dogmatic model. It is free from any sectarian things. So you can use it in any way. Anybody can use it in any way one wants, keeping the basic structure in mind. And always we will have private, what you call public classificatory systems. When you see a patient, we diagnose according to the DSM or ICD. But one expert clinician also has a private classificatory system. I classify a patient for statistical purposes according to the official DSM system or ICD or whatever you say. But I can also have a private classification of my own, where I see the client in my own way. And for me, I always want to see from the consciousness perspective. So that is secondary. The diagnosis of a bipolar disorder or anxiety neurosis is one thing, but inside I am seeing something else. I am seeing his consciousness, why he is anxious and what level of personality he is. If he is a very vital person, very emotional person, I will deal with him in one way. If he is a very aesthetic person, then I will deal with his consciousness in a different way. If he is a very spiritual person, then I just need to put his focus back onto his own self. So when I view it in a personal way, in a different way, in my own way, then I can work with the same disease with different clients in different ways.
So do I understand that you use two different ways of looking at psychiatry? One is the official language and the other is your personal intuition.
Yes, yes.
Would anybody like to ask a question?
Hello.
Okay, Graham and then Tonya.
Hi. I wrote down my question in the chat, but I'll read it out. Actually, that's probably the best thing. So I was just going to say that I'm a psychiatrist. I'm working in Brighton. I work in general UK mental health services. I'm an inpatient psychiatrist as well. So, but also working in psychedelic research also. I was going to say I come from an unashamedly materialistic perspective. And one of my interests is in trying to reconcile spiritual, philosophical, psychological, physical, scientific understandings of consciousness. One question I had was, how important is the concept of cosmic consciousness? So information from outside the mind of the individual, how much is that important for the models that you're using?
So,
I'll mute myself again.
Last portion you were wanting to, please repeat the last portion where you said that information from outside the mind.
Yeah. So how much is the concept of cosmic consciousness, and as I understand it, a part of our consciousness that's connected to a lot more outside of our own self or mind or being. So I suppose how important is that for the model you're using?
This cosmic consciousness is something actually is something which is which has to be acknowledged in psychology in a greater way. A part of it has been acknowledged, like that uh, what Jung calls collective unconscious is a very small part of the cosmic consciousness that is understood in India and or the Indian tradition. But the cosmic consciousness is a very vast field where there are huge vibrations, and what Sri Aurobindo says, that a little bit of the whatever that good things, whatever creative things that are there in the cosmic consciousness, even a little of it, when it comes inside the inner being and trickles in the outer being, that little is responsible for our great things, for our poetry, philosophy, music, and all other things. So all these things come from the cosmic consciousness. But at the same time, there are huge negative vibrations also. So what happens is an art that opening to the cosmic consciousness is not a cup of tea for anybody. So it is something, some people are very sensitive. They're always open to the outer, this outer universe, the universal consciousness. And when they're open, they have a risk that immediately negative things can come. And these negative things, some of which can cause psychopathology, because they can come and they're very disturbing, and they can cause barriers inside the inner being, so that the outer being cannot get the proper influence from the inner being or from the soul element. So it's a very important thing in Indian. In Sri Aurobindo recognizes this as one of the causes of psychopathology, when as a in possession, when all these things enter and the soul element is obstructed from working. But also, leave aside psychopathology, outside also this cosmic consciousness, other things can enter.
Sound's gone again. Your sound has gone again.
One of Sri Aurobindo's views, that the ego has to be repressed by the soul element, then it is very probable things in its character, all these things can happen. So the cosmic consciousness becomes a very important thing, which we are slowly understanding that in psychology we cannot do without cosmic consciousness. Now the cosmic consciousness is a very big area. So there is this collective unconscious of the Jung is a very small area. It's the inconscient part of the cosmic consciousness. But the cosmic consciousness has a superconscient part, which is above. It's a very big structure. No? Where we have all these things, all the prototypes of the gods and angels, they are there. No? All these symbols that we have, all these experiences we have of gods and angels and fairies and all, they also exist in the cosmic consciousness. And there are other level, there are different strata also in the cosmic consciousness. So that is a very hugely interesting subject, very interesting thing. So in the upper mind, upper level of the cosmic consciousness is what Sri Aurobindo calls the overmind, and which is the place, which is a place of global cognitive field, where you have all kinds of things at their origin, the multiplicity that originates from there. So there are very different levels. So ordinary people access the cosmic consciousness in ignorance. That is what our yoga says. What Sri Aurobindo says is, ordinarily, the ordinary person is connected with the cosmic consciousness in ignorance. Now that you have to learn the technique to be free from ignorance, to be more consciously connected with the cosmic consciousness, not in ignorance, but you develop yourself, you transcend your ego, and then you connect with the higher levels of the cosmic consciousness. Otherwise, in ignorance, we'll always be liable to have negative things also. We can have creative things, we can have negative things also. So to utilize it, then we have to access it from a poise of knowledge, from a poise of integration of a personality, which is beyond the ego.
Thank you. Thank you. Tonya, did you have a question?
Yeah, I was just thinking about when you were saying that it can go into the negative, can go into the inner being. And I was thinking about how, okay, there's a kind of a support for that. Is it something beyond what we might talk about in everyday kind of psychiatry? is it things like meditation? Is it meaning making? Is it that actually, you know, what the negative thing is, can it be made sense of with meaning to help that person get beyond that negative experience? Because it could be a, so to speak, dark night of the soul or a spiritual emergence. That could be a good thing. Or are you talking about a negative type of entity that can actually affect someone, and it's on a different kind of a spiritual level than the dark night of the soul, which can be worked through with meaning making? So is that a clear question? Is the negative energy that can affect the inner being, is that something spiritual, or is it something you can make meaning out of, and then, like with yoga and meditation, kind of go to a new level of consciousness? Or is it both?
No material base there.
We can't hear you.
The material base is lacking. There is no material base there. So entity means something which has a form. If you mean by entity, form. And when forms are there in cosmic consciousness, these forms can always interchange. Forms can always change. They're very flexible. So that's why these gods and angels and fairies, we find them always very flexible in their forms. So these entities are also there in the cosmic consciousness, and there are negative entities, of course. They come and they disturb. I was giving the example of this, the mother in Pondicherry. She had an experience when in the Spanish flu. During the Spanish flu, she was in Japan, and she had an experience when she had caught the flu in January 1919, and then she suddenly saw an entity. And what was that entity? It was a person with a head cut off in the war, somebody who had a devastating injury in the battle of the World War I, and that head had been cut off, and that being did not know that he was dead, and he was trying to suck the energies from all the living beings, and that's why people were also dying. So this is a vision which she had in front, and this vision, this entity came from the cosmic consciousness. So she immediately used her occult power to dissolve that entity, and from very that day, when that entity was dissolved, she did that work in Japan. That influence of Spanish flu stopped from that day. It had come out in the papers, but nobody actually knew how it happened. But actually, she did that occult work with that entity.
So what is it specifically, a prayer or something like that, or it's some consciousness work that you recommend?
In consciousness, yes, you have to go. The main thing is that you have to go. There are two things in consciousness work. One is you have to go inwards to the inner essence of your being, which is the inner essence. Going inwards is the soul entity, which is in the fourth dimension. So you have to go to the fourth dimension, which is behind you, which is supporting you, and there you can find a point where you can harmonize your whole being. And this is one work. Another work, the inner being have to go upwards so that you can go to the higher levels which transcend your cognitive field. So there are supracognitive levels of the mind, where I call it cognition, but supracognition is not our usual cognition. So you can go to the level where there is an intuition, and you can go further up also. So usually these levels are dormant in us. We don't use them. So first, above the mind is the higher mind, which contains all the, what you call is a place of mass ideation, where all thoughts, complementary and contradictory, stay together. So it's something where it's very much more universal, and it gets uplifted above the mind immediately. Then you are more receptive to creative things. So that is one place. So you have to do two kinds of work. You have to go upwards also in your consciousness to go higher levels.
You've cut out again.
You to the fourth dimensional principle, who is holding the whole thing.
May I say something?
Junior, yes.
Yeah. And this will tie in with what Graham was saying, his materialist view of things. Let me begin with a question, Dr. Basu. How familiar are you with the Christian tradition, especially with the notion of the new covenant?
Question of?
The new covenant. It's mentioned in the Old Testament book of Jeremiah. I could just read quickly what it says there. But basically, the new covenant is about the inner voice. So whereas the first covenant, the old covenant, is about the 10 commandments written on stone and whatever other writings evolved since then. The new covenant is more about that inner voice with conscience. According to the prophet Jeremiah, he prophesied that God would write this law in our hearts and in our inner persons, in our inward parts, I think is the exact phrase. So I see that as being essentially in harmony with what you're saying about the inner work. So I wanted to know if you're familiar with that, because and Joe would be familiar with this. Joe knows I'm always going on about this, how that's been confused. The New Covenant has been confused with the New Testament for at least the last 2,000 years. So we've got another book, basically, the New Testament.
Junior, have you got a question for Dr. Basu?
Yeah, I started with the question, but I thought because he might not be familiar with the New Covenant notion, to explain what that is. So I want to know how familiar you are, Dr. Basu, with the Christian tradition, and especially with that New Covenant concept, which I just spoke about. And then, okay, we could go into the materialist dimension of it after you've dealt with that.
All right, thank you.
But I can only tell this. I cannot tell about the New Testament. I am not conversant as you are. But I can only tell this, that intuitions come from above. We also have to train to identify the correct intuitions. Because what happens, two things. When the intuition comes to the mind mixes up with reason, rationality. And so the intuition gets disturbed. And the second thing is, many pseudo intuitions come, and we don't know how to differentiate between an intuition and a pseudo intuition. So it requires a lot of training in consciousness, how to develop the true intuition. So that doesn't come right away, it doesn't come. And the main important thing is that when it comes to the level of the mind, then the mind dilutes it with this rationality, doubts, and all things. That is why all the intuitive disciplines like astrology and homeopathy, 50% of the time they click, and 50% of the time they don't click. The reason that they don't click is that because the mind dilutes them. It doesn't understand the proper intuition. So I think that when that is done, then all these things that you are expecting, and the real interpretation, a true interpretation of the spiritual scriptures, even like New Testament, we can do it in a you can do it in a new way, in an innovative way.
Thank you, Joe. You, Jen, you had a question as well that you've been putting in chat. Would you like to speak it out?
Oh, am I on now?
Yes.
Can you hear me?
Thank you, Junior.
Can you hear me?
Yeah.
Oh, okay. Yes, so hi, everyone. And I've been really interested in what you've been saying. Doctor, it's fascinating and very valuable information, especially to us, I feel, in the West, who don't get any exposure here to this. And it's a very important thing as a human to understand. What I wanted to ask you about, first, the background is I was in India 21 years ago, and I was just walking down the street when spontaneously I felt a crack in my consciousness, which I felt was like an egg, and it just cracked open. And suddenly I was like a leaf in a hurricane. My consciousness expanded to embrace all things. And in an instant, I lost the presumptive world that I thought I knew, and myself, who I thought I was. I managed to get back to Canada by the grace of God. And I existed in that state for 3 months intensely. I didn't move a muscle. And then 3 years until I could get back to volunteer work. And it continued for 17 years until I felt myself drop back down into what the consciousness or level of consciousness that I was familiar with. I did end up in the psych ward because I was exhausted by all of this. And of course, they have no idea about what I expect. I said, my consciousness is expanding to embrace all things. They just had no idea. They couldn't validate the experiences that I was having as a result of this, or the states that I was experiencing. My questions to you is, first, what happens when our consciousness expands and embrace all things? Because to add, I think you mentioned, I experienced cosmic consciousness in complete ignorance. And I had no one to talk to about it, because when I described it, they were like, that sounds like psychosis. But to me, I was like, no, this is a real thing, and I don't know what to do. And my second question is, you mentioned the soul element, and I'm also interested to hear a bit more about that, because as I went through the psych system here, I wanted to explore what I thought at least they'd be able to help me on that level, like on a soul level. Isn't psychiatry the science of the soul? But they didn't seem to have any idea about that at all. So those are my questions, and I can repeat the questions if I was talking too fast. Thank you.
Thank you, Jen.
So I think that all these things that what you say is you have to do our inner work. For the crack in consciousness that you felt, that crack in consciousness, that when you are, unless you go inside, deep inside you will not be able to heal that crack. Or you see, you have to go inside. You cannot just remain at the outer levels of consciousness. You have to go inside, from which is the origin. And in the inside, when you go, what happens is, in the outer level, the energy we have is a derivative from the energy which is inside. But inside, when you go, you will be connected with the cosmic energy, that what we call the pranic shakti in India. So that will give you a different momentum, and you can heal up many cracks, and you can do much work on you. So the main thing is, you see in the outside, in our surface personality, we have a lot of energy, but that energy we cannot use. You see, I feel that I have a lot of energy, I will do much work, but then I can't do it. I have a headache, I have this problem, I have that problem. But when you go inside, you can just have access to the cosmic energy, the universal force of Shakti, and then you can use it. And then that cosmic energy has also many levels. There is a level at the level of, there is a type of energy at the level of emotions. There is a level of energy that is corresponding to the level of the mind, and something above. So you can catch hold of that energy, which is always, of course, there. You see, always consciousness and energy are intertwined. Every conscious plane of consciousness is a plane of energy. We are not aware of it. So we can activate that energy. What I'm saying is not activating at the outer plane. Go inside you and get access to the cosmic energy. Then your work will be much better, and then you can do a lot of healing in your own consciousness. And the second thing that you wanted, that even behind this inner being is the soul element, what we say the soul. So even behind that inner being, that going is a bit difficult. That one has to learn that technique, because it's in the fourth dimension. So when I go inside me, what happens that when I concentrate inside me, I usually concentrate in the third dimension, the space which holds our organs. So we have to go just behind it, otherwise we'll not have an inkling of what is the soul element. So for the soul element, you have to go just behind. And then that is also projection of the Atma, what we call the self, which is the unborn spirit, which is behind. So it's a big task unless you go there. Then when you go to the unborn spirit, which is the source of the soul element, then you can have a experience of impersonality. You see, when we talk in psychology, we talk of personality. But when you talk of spirituality, then you talk of both personality and impersonality. Impersonality will not be able to feel unless you can go behind to the spirit behind, because the spirit is there in the cosmic consciousness, and it is not individual, it is universal. So all those things, I think what your question was something related to the work that you have to do, or all of us have to do. Find the answers to these questions. This is a probing, this is a quest. Your questions were just a quest which we have to find out ourselves by going deep and working in a very systematic way.
Thank you very much. It's very helpful. Appreciate it.
Thank you. I notice, Elsa, you put a comment, and Graham, you put another question. And if anybody else wants to put a question and I can't get your attention, will you put it in chat and I'll ask. Elsa, do you want to make the comment first?
Natalie, my concern is I don't think I catch all the information from Dr. Samu from India, because I can't understand properly in English. But as far as I know, the information is about a consciousness outsiders, so that we call the spiritual world, and ourselves that we are immersed. As we have many incarnations, that India believes in incarnation as well, we bring in our incarnation now, the present one, something from the past. And enemies, spiritual enemies as well around us. When they find us, they can take us our weak part of ourselves, that is selfishness, prideful, so sometimes bad things. They can crack with us, they can make us be more or less mad, we can say like that. And we call obsession or spiritual attachment. So next previous meeting, we talk about psychiatric hospitals, because for us, spiritists, in our weekly studies, we study about these kind of things. When you are hearing voices, when you see ghosts, when something happened with you, you can, of course, go to the hospital, go to the psychiatrist, always spiritist psychiatrist. You can go to Catholic psychiatrists. You can go to religious people that is inside the professional field and receive help. Some psychiatrists from the United States, they even pray with their own patients. That is great. So a lot of things is involving. So I will listen a little bit more. I have no question now, but I'm enjoying when I can catch the information from all of you.
All right, thank you, Elsa.
It is good. What you say is right, that mental health is not the sole property of psychiatrists. It's a concern for everybody in the world, for everybody, because everybody, we are mental beings. Everybody of us has a mind. We are all open to consciousness, and no field, especially psychiatry, psychiatry doesn't have a monopoly over the mind. And understanding the ill mind, or the person who is ill, a schizophrenic patient, and from that I decide that what is going to be a genius or what is going to be a person who is a big artist, that is a very big generalization, which is unwarranted.
Thank you. I noticed that Joe is typing up the questions, so that'll help with us to review this. Jordana, you had a question. Would you like to put it?
Yeah, my question is, it always seems to me that behind every illness, whether it be mental, physical, emotional, that there's a spiritual problem. And I'm wondering, as a psychiatrist, because sometimes in the spiritual emergency world, there are some people who believe that mental illness doesn't really exist, and that it's just like the natural evolution of the soul, or during the natural evolution of the soul, the soul runs into problems, as you're stating. So I'm wondering if you would define mental illness as a mental illness or a spiritual illness.
Thank you.
So all mental, you see, you're wanting to say that we view everything from a consciousness perspective. Then instead of saying a spiritual illness, I would say that we can see everything from a consciousness perspective. And the people who are very ordinary people, who are not open to spirituality, will have a different kind of consciousness, and you have to work in one way. And people who are open to spirituality, they will have a different kind of, again, another kind of consciousness they will have. So they have another set of difficulties. So the main thing is that we work on the consciousness model, and that consciousness model we can use for spirituality, and also for people who do not have access to spirituality, who are more rustic, who are more who are not open to any things which are which you can call to be of something which is related to the divine, something which is related to going inwards. So everybody will not be open to that. So it is better to be talk in terms of consciousness when we talk about spirituality. So we know that we can restrict ourselves to people also who are not open to that level. We can only work at depth with people who are receptive. People who are not receptive, clients who are not receptive, who are at a very rustic level, at a very vital level, there we can't go inside. It will cause problems. Like in psychoanalysis, you can't do depth psychoanalysis with schizophrenics. It can cause disruptions. So it is the same thing here. Another thing about psychoanalysis, what I will say what Sri Aurobindo said, that he has warned that unless you have got an experience of spirituality deep inside you or above you, it is risky to go to the unconscious, because you can unearth things which you will not be able to handle. So always he said that people who are practicing spirituality should only go to the unconscious after they have a poise, after they have achieved a poise, either deep inside their inner consciousness or somewhere in the consciousness above the mind. And otherwise it is very risky. You can go and cause more problems to the client and to yourself also.
Thank you. I'm aware of the time. Is anybody who hasn't asked a question who would like to?
Yes, spiritual emergency is an illness. Spiritual emergency is an illness. I told you that there are different kind of spiritual emergencies can happen. One can open oneself to the divine, but one is not ready to take the full force, which is a very common thing we see here. Everywhere it must be seen. I see a lot of cases in India, young people who go to ashrams to become yogis and all, and they are very, very sincere, but they are not worked upon themselves. So they have not done work on their personality. They are not prepared. And when something comes, they can't hold it, and they can get disrupted. They can become psychotic. So this thing can happen. Then I told you that between the inner being and the outer being, there's an intermediate zone where the people practicing spirituality, they can lapse into that zone. And then you can be subject to hallucinations and delusions and many sorts of things. So in spirituality, all sorts of things are there. And then the inner being can progress very, very fast. And the outer being cannot progress so fast, because you have neglected your outer personality, neglected your body, while you are only concentrating on the spirit. And then what happens, because of this gap between the inner being and the outer being, then one can also have a great illness. So all sorts of spiritual illnesses can happen to people who are actually sincerely practicing spirituality, because they have not worked on themselves properly.
Thank you. Steve, would you like to ask your question? Can you unmute yourself?
Yep, can you hear me?
Yes, we can hear you now.
Okay, hi everybody. Yeah, I was wondering about what you think is the role of medication in psychiatry, and what you think of kind of standard materialist assumptions that depression may be caused by a chemical imbalance. And do you personally recommend medication in certain circumstances?
See, there are people are actually, when they present to us, they are at different levels. So at one level, medicines are required, but then you have to use it with caution. For example, sometimes I take help of some occult knowledge. I take help of that occult knowledge. I have friends who do practice actually occultism in a very sincere way for some of my patients. But those patients also outwardly, they need a meet of medications, but medications are not enough. Medications can't cure all problems. You see, even for schizophrenic patients, we see that we can just subdue delusions, subdue hallucinations to some extent. Can we cure everybody? We can't cure everybody. So there is a limitation. I would say, preferably what I practice is, when I have to give medications, I give according to the consciousness of the subject. If the subject is very sensitive, very spiritually oriented, then I would always prefer to give as little, if not not to give, and if to give, then to give a very little medication, so that I can help just that person to turn inwards. Now, if a person is an artist, the aesthetic person, I would not want to give him that kind of medicine which thoughts his activity, artistic activity, which numbs him. I don't want to give that. So if it is necessary, I will give dose which is much smaller, which is criticized by my friends who tell me that every patient is the same, we have to give the same dose. But I don't agree with that. Absolutely, I don't agree with that. I believe that we have to, for every person, we have to do it in a different way. And everybody will not respond. You see, for chronic schizophrenics also we see that at the end, too much medicines also don't matter. You see, whether you give little medicines or more medicines, patients remain the same, chronic cases. So there is always something else that is happening, and we have to be sensitive to that. And then there are, of course, some occult cases where you have to, the more focus is on to do some more of this kind of spiritual and occult work, which is more important. The medicine becomes very secondary.
Thank you. Thank you.
Thank you. Karen, would you like to ask your question?
Sure, yeah. I work with a lot of people who have a spiritual dimension to their experience, but also when you start to look at the narrative of that person, there is often trauma from a very young age. Anything from sexual abuse to physical violence through to different kind of issues. And what I see quite often is that the person has learnt in childhood to dissociate from the horrible experience that is happening to them, and this somehow, it feels almost as if this then opens them up to that other level of consciousness or that other other places, obviously without any learning of what they're actually doing. And but I don't see, and often these people get labelled as schizophrenic. My own husband is an example of that. So I don't agree with you that when you say that people with chronic schizophrenia or whatever cannot benefit from some kind of counselling, psychotherapy. My experience is people very much can, but it's pulling apart what is their experiences, their trauma, but also the spiritual elements. What is that about? And is that an escape from what they have been going through, or is it also teaching them a different way, compassion, all kinds of different things? So I just wondered what your experience is of working with people who may be labelled with schizophrenia or psychosis, but actually trauma is at the bottom of their issues.
It's something which is a very delicate thing. Some people, you see, traumas are also very different kinds of traumas. Now there are traumas which are of very, very different kind. There can be occult traumas which are very, very serious and then can cause great problems. But because they are not understood properly, the person suffers whole life and only gets medicated with psychiatric medicines and suffers more and more for that. So you see that trauma is not only a psychological and physical thing. There is also something, an occult dimension of trauma also is always there. So this is something very, very serious. I don't think that trauma we understand very properly. Trauma, of course, has a very big occult influence, which we don't understand. So what you're saying is very important. It is very wrong for us to label all of them in the same way as we label in the outside world as schizophrenics. That is wrong, because it can have a devastating effect. Occult trauma at a very young age. I have seen a girl whose father got separated from the mother, and the father used an occultist to disturb the girl, and the girl was disturbed in such a way that she would have died, which you had seen. And then we had to use because the father took a help of a Muslim occultist to do all sorts of negative things to the girl, and then we had to work on that girl, not only with our counseling but also with the help of occultists, both Muslim occultists and Hindu occultists, because they work in India in different ways. And you see that trauma, still the girl suffers from that trauma, but she is much better after our interventions. But if we had not done that, she would have been drugged with too many medicines and she would have been made a chronic mental patient. So we have to give sometimes a little bit of medicines when she is very restless, but that medicine becomes secondary. Because we have always recognized her occult thing as primary.
I suppose what
will be labeled as a chronic mental patient.
Okay, I suppose what I'm interested in is this idea around dissociation as well, though, because it's something that I see very often with people. And also, I think with trauma, it almost feels as though your soul has been taken from you. So I see that many people with these experiences are searching for their soul, because in their life, their spirit, their basic who am I is being taken away by others.
Yes, yes, what you say is correct. That is what also Sri Aurobindo said, that all these cases which we label as chronic psychotic patients, many of them actually have been in a subtle way, they have been influenced by forces which do some kind of work, do some kind of possession, do some kind of intervention in your being. So this is which we don't recognize, but it is usually an intervention of hostile forces outside which go on creating disturbances inside you.
Thank you.
It's a new field which you have to now understand how, as science and spirituality come closer. In the coming days, it will come more and more closer. Then all these things will open up, and we'll understand these things better.
Thank you. Samin, did you want to ask a question? You'd have to unmute your microphone.
So Joe was asking me about this. Someone was asking me about this mother's experience with that headless entity, which she saw in the Spanish flu in January 1919 in Japan, where she had actually that vision of that entity, which had the head cut off because he had a disastrous violence on him during the World War, and he didn't know that he was dead. And that is why the beings like him were sucking up the energies from all the people, and people were dying as a result. And that is when she intervened with her occult force to stop that phenomenon.
And is there any insight on what is happening now in the world with this symptoms of illness that people are getting?
We are just the whole story. It is not unraveled fully, so we will understand it better. And the more and more it unravels itself. I think it's a very complex issue. There are many levels operating, but definitely there is occult factors which are operating, and somewhere the balance has been upset. Now the balance has been upset due to many reasons. I think that many reasons have conglomerated together. So it is not only the occult factors behind the psychology, the occult factors also behind the ecological balance. All these things have been disturbed because there is a spirit in everything. There's a consciousness in everything. If they can also be disturbed. You see, the consciousness even in the earth, it wants to manifest itself. Silicon, like silica. Silica is 90% of the stones in the earth, they are silica. And you see that silica chips are needed for the artificial computers, for our computers. So silica, earth also wants to take part in the consciousness, in the evolution of consciousness. Now, if you are denying that, then we have to face many consequences. So I feel here that occult factors are also operating not only at one level, at many different levels. But we'll understand it better as the whole thing unravels. Maybe you have to meditate on it, you have to think on it.
Yes, we don't often, by the word occult, when I learned when I was in India that the word occult simply means hidden. It hasn't got the baggage that we use it with in the West. I'm aware of the time. What I'd like to do is ask Joe to just summarize what we've been doing, and then Dr. Basu to have a final word. Joe, would you unmute yourself?
Okay. So correct me if I'm going off track or if I'm following it right. Okay, so firstly, we're talking about integral health and how there's different levels of consciousness. Like, for example, there's the physical, the vital, which is more sort of affective, emotional energy, the mental level, and the subliminal level, which is more to do with the intuition, and how when we have an energetic disturbance or mental health difficulty, it can be a combination of these different levels of consciousness. Whereas in the West, we can focus more on the material, physical level or the mental level, but this is more associated with the ego. And there needs to be a balance between the ego, the outer being, and the inner being, which I believe is to do with the psychic being, like the center, maybe the Atman, perhaps. I'm not sure. Dr. Basu might have to correct me of that. And when we have this balance, we can evolve our consciousness. And people who have spiritual emergencies or have crises or trauma, and it hasn't been healed, it's due to this imbalance. And through strengthening our ego in the outer being, in the world we live in everyday life, and also experiencing an inner work, we can be in harmony with ourselves and others, and we can be in touch with the cosmic consciousness in the world and around us to be guided, but not too much. And that things can happen, for example, with psychiatric medicine, it's used to help people when they're in too much distress, but you don't do it to restrict their consciousness. If they're very creative and artistic and very spiritual, because it can create more disturbance, and it's used there just to help balance the person when they can't balance and manage the experience themselves. I'm trying to think if there's any other things I've led that's important, because about being from a physical, materialist perspective, how these different levels of consciousness can expand on that, and it's all a very complex thing to understand.
All right, thank you. Dr. Basu, would you like to just make a few comments about how you found doing this Zoom and the questions people have asked?
It was very interesting. What I want to say is that if you work with the consciousness, then you are not only helping the therapist, it is also you are growing yourself. So we have to take this model that for us, this is also a spiritual pursuit, that in helping our clients, we are also ourselves growing in consciousness. If we keep this model only, then we can always have a very thriving relationship in this area, where we have to continuously grow and exceed ourselves. And then only also we can work with our clients, and then they can also grow. So it is a two-way process that we have to keep in mind. It's not the old sermons, like the analyst sitting in the armchair, and giving a sermon to the client. It's not like that. It's a participatory journey where both of us, the client and the therapist, we have to work together for a new journey, and a journey into ourselves and a journey above ourselves, a journey in consciousness. So it's a very interesting thing. I think at times we can have sometimes a more detailed what you call this kind of interviews and discussions on consciousness itself, because consciousness itself has to be understood in the way which we want to work, because the materialist world will think that consciousness is only a material thing. You see, the same way we are talking about this, Harari now said that when the new the Homo sapiens is going to end, and then we will have new kind of beings with artificial intelligence, beings of cyborgs and all. But that is, he is talking in a materialistic way. We want to have new beings, but beings with greater consciousness, beings with a soul. We don't want to become artificial computers. We don't want to become that. So unless we carry on this discussion of consciousness, then people who are working with consciousness, they will give more emphasis on those external things. Like that, they want to have that the next, after the Homo sapiens, the cyborgs will come. But we are all, I told that we are all used to cyborgs. They're half animal, half animate, half inanimate. When we put a pacemaker inside us, then that is also, we are a cyborg. When we put an artificial lens inside our eyes, or we put a steel plate when we have a fracture inside our leg, so that's also we are using an inanimate object inside. So I don't think that they are saying anything new. What is new is that we have to develop a new consciousness, and that consciousness has to have a soul that is evolving. And if we don't do this, what I was thinking, that this is a crisis. What we were just before this, we were testing, and Natalie and Joe, we were talking together. If you say that what is this crisis that is going on in the world, one of the main things, the background crisis is a crisis of evolution of consciousness. In consciousness, we have to evolve to being greater than ourselves, exceed ourselves, to being greater beings. And unless we do that, we'll have all kind, we'll get stuck up, and we'll have all this kind of sufferings that we are now exposed to. So we have to see the present crisis also as a crisis that is happening because we are not wanting to evolve in consciousness. We want to be stuck up in mediocrity. So that is one thing.